Hey all, it's Dr. Susan Lacey. I hope you've had a great weekend. I'm just at home on Sunday evening, and so I wanted to take this opportunity to talk a little bit more in a little more depth about transgender care and our focus on that, and also how you can work on being an ally, and some pretty simple things that you can do sort of to get started. And so, I've been asked a lot of questions, even down to the definition of tell me exactly what does it mean to be transgender? What does that mean? And let me first say that I am not transgender. I am a cisgender heterosexual woman. I have a transgender child, so I'm a mother, and of course, I'm a physician and consider myself an ally, and have focused in the past 5 years or so on learning more and more about transgender care. But I don't mean to suppose that I can say I understand what the experience is because it's not my experience. And I think that, and I'll circle back around this at the end, I think it's important to remember that and to recognize that it's really important to hear from people who are going through the process. What I'm going to talk about more is my experience and my practice and how we have learned to approach the process of what we do. But one of the other things that we've been trying to share and plan to do more of is share some actual experiences with our patients and people that we work with so that you can hear from people about their actual experience, because I think that's just crucially important. And so first, let's talk about basic stuff, definitions. So what does it mean to be transgender? Well, first, let's understand where the terminology comes from. So for those of you that took chemistry, certainly organic chemistry, which, I don't remember very fondly, but I did have to do. But cis and trans are chemistry terms. And so a cis bond, or CIS, bond is a bond that is on the same side as the carbon atom, and a trans bond is one on the opposite side. Now that's sort of scientific, but that's where the term came from the medical standpoint. So cisgender is meant to identify somebody whose sex and gender are the same, and transgender is someone whose sex and gender are different or opposite. And so let's talk about what sex and gender are, because we all think we know, but the reality is that, now as we're defining these terms are a little bit different. And so sex is your biology, essentially. Not completely, but basically your genetics and your, organs and manifestations and outward presentation of sex. And so gender is a little different. Gender is how you identify yourself. And then gender expression would be how you express that gender outwardly. And non-binary, which is another term that is under the umbrella of transgender, is somebody who does not identify with either gender, and sometimes it gets a little subtle. So I am talking in fairly simplistic terms, but those are the main terms: sex, gender, gender expression. And then sexuality is a completely different thing. So sexuality is who you're sexually attracted to. And obviously there's a range in sexuality as well. Interestingly, I have found that sometimes it's hard for transgender people, not hard, but they express their sexuality sometimes in terms of their sex and sometimes in terms of their gender. So when we talk to patients and we talk to people, we ask very specifically. I basically say, who do you have sex with? Men, women, both, trans? I want to, for me, it's important because I'm talking about other issues related to sexuality. But sometimes sexuality gets a little confusing. But gender identity and sexuality are completely separate things. Okay, so that's step one. So why is it important? Why is this stuff important to know? Well, a large percentage of people identify as transgender. 0.5%, that's the statistics, 0.5% of the population. So we live in Memphis, based on our population, that would be 30 to 50,000 people, depending on the area. And I see people for the 3 surrounding states, including Arkansas, Mississippi, Alabama, and then Tennessee. So that's many, many people. That's the take home. Is that number exactly right? We don't, it's hard to know exactly, but it's, there are a lot of transgender people out there. And I tell everybody, if you think you've never met or known a transgender person, you're wrong, because you have and you will. And so, for me, I think it's super important for us to just respect one another. It just comes down to that. It's a simple concept, but, we should respect one another and we should understand one another, at least to the best of our ability. So, um, how do you implement this in a practice? And why is it important? Well, so let's talk about some common statistics or some things that transgender people go through. What what do they go through? Well, fear, discrimination, absolutely, um, dismissal, and that can be really, really damaging, particularly in a medical setting, and violence. And those are just the broad brushstrokes, simple things to say, but those are common things. And 30% of transgender individuals, and I think it's must be, excuse me, much higher than that, but 30% will say that they have avoided seeking health care because of fear or fear of dismissal or discrimination. I think it's higher than that. But I mean, I think for all of us who've never had to face that, think about how terrifying that is to have a simple problem and be very uncomfortable because you don't know what situation you're going to walk into to have that problem dealt with. And so that's, vitally important for us to address and to fix. 50%, um, and again, I think it's higher than this, will talk about or express the concern of having to explain their care to their provider. Now, I sometimes somebody tells me they're on a medicine and it's a new medicine to me and I have to Google that or look it up. That's not what I'm talking about. I'm talking about going in and having to really, at a deep nuts and bolts level, explain your care to your healthcare provider. That is not a confidence, instilling situation, because if somebody doesn't understand the medicine and the process, then how are they possibly going to help you with, the subtleties of care? And so those are sobering statistics. And again, I think the numbers are higher than what I said, but it's really important that we all should be able to walk into the doctor's office and feel that we're going to be respected and heard, and we're going to be dealing with somebody who understands our concerns and is able to help us. Now, I mean, I have people come in and ask me questions all the time, and I say, that is out of my purview, and that's okay. But I think, making sure that there are providers that really understand how to provide transgender care is really important. So for us in our practice, the key is first you ask everybody. And I tell everyone when they say, well, how do we do this? And I've done some discussions for St. Jude and UT and with medical students and residents. I always say you ask everyone, every single person that walks in the door. We ask their gender identity. We ask their sexuality. Now, sexuality is important for me because I'm a gynecologist. And so I'm talking about the issues that go along with having sex. And so it's very important that I know that. It may not be important for every other physician, so I think it is relevant. But everybody, we don't make assumptions about anybody that walks in the door. And then we ask what name the individual wants to use, everybody, because some people may use a different name than what is on their license or on their insurance card. We ask what pronouns, and we make every single effort we can to respect those decisions and utilize the right pronouns and the right name. Sounds simple, but it's just, a commitment to doing that. When I see my transgender patients for the first time, the first question after sort of basic introductions is tell me your story, tell me your history. And sometimes I get 5 words and sometimes I get 15 minutes. And I try to at least get a good background in the people that are uncomfortable or unwilling or reticent. But I think it's really important for me to know where people are coming from, because when they first come to see me, they often have tried other medicines, or maybe they've bought something online, or maybe they have heard something. There's a lot of misinformation, a lot of great information, but a lot of misinformation out there. And so it's really important for me to know where this person is coming from. Are they living in a safe environment? Who are they having sex with? Who do they live with? Who are they out to? Who have they shared this information? Who's their support network? So that's really, really important. And so that's really the most crucial first step. And I think that's what we all need to think about when we're talking with transgender people is how do we um, understand where they're coming from and listen, and I say that again, and listen and hear what they're saying so that we can provide good care. And so then we step into the actual part of care. And that, I think, I'm not going to go into incredible detail, but there are different facets to transgender care. First part of it is that you want to know what their goals are. Usually, the goal is to initially, is to hormonally transition to identify gender. But not always, and sometimes with people who are non-binary, it's sort of a matter of figuring out where you want to land. Sometimes people are much more focused on surgical transition, but hormonal management is first. And for transgender men, we are starting testosterone therapy, usually in an injectable form, but there are other methods and ways to do that. And when you do that, it will bring the estrogen levels down fairly naturally just by supplementing testosterone. And so that's the goal, is to get the testosterone into a close to male sex range testosterone. For transgender women, there's sort of a twofold process. One is to suppress testosterone, and there are some sort of standard and traditional ways, and there's some alternative ways, which I actually really like, to do that. But the goal is to suppress testosterone down to a cisgender female range and then supplement with estrogen. And you can do that in multiple forms as well. And like I said, for non-binary individuals, it's often a more subtle discussion about what our goals are going to be. And so that's first. And so hormonal management is first. And generally, I recommend, and most surgeons will recommend, a year of hormonal therapy before anything surgical is done. I think that there's a common misconception that everyone out there who's transgender is going to have this complete reassignment surgery. And again, terminology has changed a little bit. But gender confirming surgery which is what we would call bottom surgery, or surgery on the genital area, is much, much less common and tends to be a several step down the line process. Usually it's hormonal therapy first, and then top surgery, which is either breast augmentation if necessary, or breast removal, which is a very, very common and very desirable intervention for transgender men. And then ultimately bottom surgery, which is usually later. And there are local surgeons that can provide cosmetic and top surgery. For the bottom surgery, usually we don't have, at this point, we don't have anyone in Memphis, but when we refer to a tertiary care center, I usually refer to Vanderbilt for that. But a lot of people don't ever have bottom surgery. And so that's another common misconception, is that everybody's out there having, major surgery, and that's not the case. There are great studies that show that a large percentage of transgender individuals will be perfectly happy with, transitioning and presenting gender expression, the gender they identify with, and hormonal therapy without ever having the bottom surgery. And so, those are the sort of surgical things. We also talk about potentially cosmetic and aesthetic things, which can involve, of course, surgery, but also things like skin resurfacing. We're really focusing now on trying to do some cosmetic training and having people in our practice that can help with cosmetics application, as well as potentially hair removal. We don't do laser hair removal yet, but it's on our very soon wish list. And so, kind of helping someone with all that process. There are opportunities for voice training, even voice and vocal surgery, and skin resurfacing, and other things that may help with gender identity and presentation. And again, that's a very individual thing for each person. And then also we will help with things like letters for gender marker and name changes on license. Getting into birth certificate, I won't go into that detail, is sort of state by state and can be very different. But changing your gender marker, changing your name on your license, and all of that can be really, really important part of the process. And so we can assist with that. And so that's kind of where we start. And, I think the main thing is to realize that you just need to meet people where they live and ask the questions, ask everybody, respect the answers. Um, Something else that I would say is, and these are sort of take home messages, is one, is realize that we live in a world where we use very gendered language. And as I've come into this, I've realized there's a lot of terminology. You can use the word sibling instead of brother or sister, for example, or spouse or partner instead of husband or wife. It doesn't always work, but as you start paying attention to that, you will notice how gendered our language is, and you can make some very simple changes. I encourage you to put your personal pronouns on your email signature and use them where appropriate. Those are simple things that we can do. One other thing that I want to say is very common, and people ask me all the time. So they say, well, so and so used to be a man or used to be a woman. And that's a really offensive thing to say. And I know maybe that's hard to understand, but a transgender person was always who they are. Whether they fully understood it, had the terminology for it, had a realization for it. And so once they have made that gender identity, that is their gender identity, and it always was. And so you don't ever really want to say that. And I think that that's a very common thing for people to say. I read something the other day that was a great example. It talked about handedness. And we all, are left or right handed. A few of us are a little ambidextrous. I'm a little bit ambidextrous, but no one told us what hand to use. We just did. It's just part of how our brain works and how our brain is wired. And so if you're right-handed, that's who you are. In the past, they would try and train left-handedness out of people with some success. And so you can retrain people. You can insist that people use a certain hand, but the bottom line is the hand that they're designed to use is hardwired into their brain. And gender really is this, think about it in the same way. And so what we're trying to do is allow people to be themselves. And for me, I just think that that's a beautiful thing. Like allowing people to have a place to be the best possible version of themselves and to helping them achieve that is really kind of what it's all about. And no matter if it's my transgender patients, if my hormone optimization patients, my GYN patients, anybody, that's the goal. And so I hope that's helpful. I'm certainly open to any thoughts, concerns. If anybody feels I've misrepresented anything, please share that with me. And we have a blog post that's gone up today that also details some of this a little bit more, so you can check that out. And of course, for those of you that may not be aware, we've struggled a little bit because this practice was founded right before COVID hit. And so as most small businesses and certainly even medical practices have struggled some financially, so we do have a GoFundMe going on to help support the practice. So if you're inclined to contribute, any amount is very welcome, and we're very thankful for that, or share that information. And so that's pretty much it. And we're going to start doing these regular Sunday discussions about all kinds of things. So I look forward to sharing more information with you in the future. All right, have a great evening.